trauma has various forms and shapes, and therefore there is various forms of impact. So let me explain what I mean by that. So the trauma could be, which most people are aware of, that kind of the trauma comes from the war experiences or experiences of being in a conflict zone for a longer period of time. But we also know that trauma is where it comes from adverse childhood experiences, says, or adverse past experiences. But the trauma could be present in people's life as we speak. For example, domestic violence. People are trapped in the situation where they are exposed to trauma in a day-to-day life. What most people have heard about the diagnostic term called PTSD, or post-traumatic stress disorder, which is often a result of war or long-term tortures or natural disasters. And usually they have similar clinical features or symptoms or similarities, let's say. But here I want to highlight those two other types of trauma which are not often talked about. One is called adverse childhood experiences and the previous traumas of the past, and the ongoing traumas of being trapped in a difficult situation, whether it's a difficult work environment or a relationship such as domestic violence. So what I wanted to say about that is that my role will be, with regards to when it understand about the trauma-informed mental health care, is to take a good trauma history. What that means would be either using a questionnaire or a structured assessment to, with the kind of all the sensitivity required based on your history and your presentation, to identify how the trauma has impacted you. And in that case, using this information to draw up a formulation which will then guide us to draw up a care plan based on your needs. So trauma can affect us in many ways. Let me break it down into different aspects of it, which is the psychological aspect, the physical health aspect, and the social or cultural aspects as well. With regards to psychology or psyche, trauma affects our self-esteem, our well-being, brings the concepts such as shame or guilt, creates anxieties, difficulties in relationship, for example, trusting people. It can cause fluctuation of mood, it can cause impulsivity, and eventually can lead to serious mental illnesses such as depression, long-term anxieties, and other significant mental health problems such as self-harm and drugs and alcohol use. When it comes to physical health, trauma can affect our body in many different ways. So when we look at the brain, for example, trauma has effects on our the primitive brain function called amygdala, or reduces the kind of our capacity to rationalize the thinking based on our higher cortex functions or medial prefrontal cortex, let's say. But trauma can also affect genetics. People are now coming up with the researches to say that the effect of trauma can pass on to generations through the genetics as well as the effect of trauma or psychological effect of trauma. And finally, I just wanted to touch base on social effect. If somebody's self-esteem is affected, there is a ongoing shame or guilt. It hinders one's capacity to take risks, build trusting relationship with the people around them. So therefore, the trauma can affect the social environment, and the connections people make with other people can lead to loneliness as a result of this, if it is not actually addressed or understood as well. So here I touched base upon some of the key aspects of how trauma can affect psychologically, from physical health point of view, and socially as well. So psychiatrist is a trained mental health professional who has a sound knowledge of physical health and the body, and also the robust understanding and training with regards to psychological health and well-being. Apart from this, psychiatrists also have much awareness and understanding of the social, cultural, and spiritual circumstances and their impact on mental health and well-being. This means the psychiatrist has one of the most comprehensive knowledge of multiple factors that can affect one's mental health. So starting with, as I mentioned before, a comprehensive history where one can use trauma-informed care to explore and evaluate the type of traumas and their impact, and then to draw up a summary, which then psychiatrists will discuss with their patient or the service user to identify key areas to focus on and how to support your short-term and long-term objectives during the path of recovery. Psychiatrists then can lead several parts of the management using the knowledge, skills, and training, mainly in relation to relevant physical health illnesses or physical health matters, and also prescribing and monitoring psychotropic medications for mental health. They can also discuss other areas, for example, psychological related matters, psychological therapies, drug and alcohol matters, social aspects, and other relevant factors, and make recommendations how to seek support in other areas.